Hey guys, it's Coach Roy from RPG Training Systems here with my good friend Kirsten Wishloff, Dr. Kirsten Wishloff. And I want to tell a quick story, and then I'll let Kirsten kind of give a background of her history, her training, her education. So we met when I was running metal sports training, introduced through a mutual colleague, Tien. And then from there, it kind of the relationship blossomed. We started working together with TAG, the Athlete's Grid, which is her baby right now. And we've really just kind of kept in touch since that point. And I'm honored to have you here today. So thank you.
Thanks for having me.
Yeah. So quickly tell the viewers a little bit about your background and why you should be listened to as a kind of an expert in this field of sports medicine.
Cool. So I was a volleyball player. I played at Grant MacEwan in Alberta. And I have had every injury you can have as a volleyball player, from jumper's knee to rotator cuff to lumbar disc herniations. I've run the gamut. I've had it all. And then I learned about it for a long time. So I have a background in kin from U of A, and then worked as a strength and conditioning coach and yoga instructor for 2 years, and then took my education further and came to Toronto to do chiropractic school. Awesome. And then since then, I've been working really closely with athletes from kind of all different sports, pretty closely working with Sailing Canada right now, and some different golf clubs, and still doing some work with some beach volleyball players in Toronto as well.
Nice. Yeah, I think one of the TAG team members is a professional volleyball player right now.
Yeah, we have Megan Naj. Well, yep. Megan DeHaad now. Yeah, so nutritionist.
Yes. Yeah.
Yeah.
Definitely. If you're watching, get on and check out some of the content that you're putting out, because I've been following your Instagram, for the last few years, but I know recently you've been putting out a lot more corrective content and things of that nature. So kudos to you for that. And the quick tip nutrition guides that Mars puts out every week or every couple weeks. So yeah, it's good stuff.
Nice.
So I want to get right into the kind of the meat of this conversation, which is around volleyball athletes. And being a former volleyball athlete and an injured volleyball athlete, I'm in the same boat. I think we came into this profession because we'd had so many injuries, and really the purpose is to kind of prevent that in future generations, if possible, if they listen to us. So if we narrow our focus on volleyball specifically, what are some of the major, I think you mentioned a couple, major injuries that you find when you come into contact with a volleyball player that comes into your office for the first time and says, I've had X? What are some of the common ones?
Yeah, I mean, just off the top of my head, if we were making a list, it would be rotator cuff, so like anterior part of shoulder, lower back, knee, so tendons of the knee, and then your ankle sprains are usually kind of the list of common injuries within volleyball athletes.
And do those, do you notice, and this is, I'm throwing this question kind of randomly at you, but do you notice at a certain period in their development that more of these things come on, or maybe certain parts of the season that you see more injuries come on?
So, often it's position specific as well. Like you'll see different injuries depending on the athlete, but the other thing as well is what else you're doing. So are you playing another sport? Are you accounting for that volume? So I think a lot of kids who are multi-sport athletes are really beating up their tissues more than they're aware of, because they're getting kind of 2 sports worth of volume, especially for stuff like jumper's knee or shoulders.
Interesting. Yeah. Because I'm a big advocate for multi-sport first. And then if you can't do multi-sport, at least insert training as kind of the fill-in. I mean, you should be training all year round, but it's interesting that you say that, because for my approach, or how I recommend sport programs to athletes, is say pick an opposite sport spectrum. So do, soccer and volleyball. So that way you're using different tissues and things like that. Is that something you commonly have a conversation with your athletes, or is it mostly just, here's the issue?
But it's challenging. So it's good, especially up to a certain point. If you're a youth athlete, mix it up, play lots of sports. But the challenge is when you start to get specialized, starting to understand and having someone to help you navigate how much volume you're putting through your body. So for me, from like a personal experience, I was playing provincial level volleyball and soccer. And so you intuitively, you're like, these are different sports, but I torqued my back because there's so much rotation. So both sports involve a ton of rotation.
Yep.
And so having someone to have the education to know that this is happening to you versus coming in and being like, that hurts, is a productive relationship developed early on in your athletic career.
Totally. Yeah. Kudos to that. Cause I'm very similarly, I was playing football and baseball at the same time. So it's a lot of, swinging one direction, rotating and throwing in the other direction. So there's a ton of torque, and obviously why I had a back injury at such a young age as well. So, now if we're getting into the tissue wear and tear, and again, in that example, kind of soccer to volleyball as an example, what are some of the rotation being one, what are some of the common patterns that you see in volleyball athletes that you would start to address with them at an early age? And I'm asking from a standpoint of, I know what I kind of look for when I start working with my youth programs. What are some things that you look at from a clinical standpoint to start to manage that wear and tear, or some of the patterning that they develop over time?
So it depends on what the athlete's doing. Like if someone's working with you, I generally leave the tissue volume to a trainer. If someone's taking care of that in a responsible way, awesome. Let the volume be managed. Things that I'm looking at is integrations of a deeper stability system. With volleyball athletes, one of the more common things I see, especially with shoulder injuries, is dysfunction of their neck. So is your neck able to generate stability? Because that's the top half of what's stabilizing the structure. So we can do core work all we want, but if you haven't identified the stability dysfunction in your neck, you'll continue to have that anterior shoulder pain. And I think you feel pain in the front of your shoulder, but it takes time to start to understand what that feels like in your neck or in your upper back or different structures associated with it.
Okay. Interesting. So, we're going to come back to that, because I think one of the questions that I have down is, how do we address the shoulder? So we'll kind of go through some of that, the strategies. So this is interesting because it kind of ties into a bunch of the different questions that I put down. So if you start working with an athlete or a program, what are some of the initial instructions or interventions that you would come into? Now, I know that's extremely broad. It's, again, position specific, how much volume are they taking on? But as a general rule or a general system, what are some of the immediate interventions that you would take on? And then as you they become familiar with your system, how do you start to evolve that with the athletes? Again, kind of global, not specific.
Totally. Again, if it's coming from a place of pain, we work to mitigate pain first. But if we're just evaluating the athlete and their functionality overall, easy first place to start is, where's your rib cage and where's your pelvis? Are these things rotated? Are they extended? What position is kind of your core of movement coming from? And then tying that again into the neck and the feet. So these are driving stability through the system. So instead of kind of working out on what hurts, let's bring stability and integration centrally, and then start to navigate outward if those problems aren't being resolved with that intervention.
Awesome. And so, I have a bit of an assumption, but what are some of the initial findings that you have with volleyball specifically when it comes to that pelvic and rib cage alignment?
Yeah, you'll notice down regulation of different oblique slings. So, if you're a swinger, right, you're going to have one diagonal that's super strong, but the other one is often not activating super strongly. So then you're suddenly in this position of rotation all the time, which changes the relationship of your shoulder blade on your rib cage, which is problematic in the long term. So from just like an easy perspective, you can look at rolling patterns. I don't know if you use much of that, but kind of like lie on starfish on the ground and like try to roll one way, try to roll the other. Is that easy? Is that challenging? Palpation, just like, does your pelvis move this way? Does your rib move that way? Or just easy places to start. Even if you're just sitting in a chair, turn one way, turn the other. Is it harder to go one way than the other? And that's a really good check for athletes, for lower back injuries, for knee injuries, for shoulder injuries. That's a quick place to start.
Yeah, and I think that's a kind of a key piece of information is, I think it becomes second nature. People kind of tend to rotate in, like you said, in one direction. and it becomes so habitual that they don't even recognize it. And then even, I mean, for me, and you had done some work with me, like I couldn't rotate my head in one direction relative to the other. And it was like, oh, I didn't even really realize that until you told me to do it, how like simple of an assessment that is. But it's like, well, yeah, you should be able to look both directions equally, or you should be able to rotate equally both sides. So when you get into the rolling patterns, how do you get that? How do you work with an athlete on that immediately? Do you start kind of in a prone position, lying on their back, lying on their stomach, or do you just say, here's the gamut, like here's a bunch
Depends
of
what you're trying to get out of it. Like I generally do a more organic assessment. Like at times you could do like checklist piece by piece, but often as just like kind of a global look at their movement. Lie on your back in a starfish, start with your right hand, try to turn to your left. When you're lying on your stomach, good, take your right arm, try to come back. Pick limb by limb and try to initiate the rotation forward and back with each limb. Yeah. It's as simple as that. And really all you're looking for is, was there one that was hard to initiate? Was there one that looked really disconnected? Or obviously if one caused pain. Yeah. And it's just like a super quick, easy, very functional screen, especially for anyone who does like a throwing sport, anything rotational. Yeah. Yeah.
Oh, that's awesome. I mean, give it a try. For those of you watching, just lie down right now and start rolling around on the ground. I do incorporate that in, especially, I mean, as we advance the program, we start adding, resistance or loading to it so that we get that kind of overload principle to start to develop those patterns even further. But yeah, coming back to just the ability to do that without, like you said, pain or limitation is huge. And I don't think people, myself included for a long time, don't really fully appreciate that kind of slow baby step approach to it. It's like, okay, well, I can roll over somewhat equally now. Can I start lifting? It's like, well, yes and no. I mean, if the problem is not going to go away, it's not going to go away with weight on it. So
yeah, it depends on what the problem is, right? In some instances, maybe it does. Like if we're talking a tendon issue, maybe it does go away with loading, right? So
yes,
it depends on what you're working through.
Yeah, well, so I'm glad you said that, because there's obviously different ways to approach it, and if you're watching and you're listening and you're super confused by this, then this is good. This is why you need to work with a professional who knows what they're doing. So in that strategy, so let's say, okay, so we've recognized a bilateral or unilateral pattern deficiency. Let's go to the next step. So in the example of, you'd mentioned jumper's knee, what would be, let's say there's symmetrical on both sides, so the rotation is good. What would be your initial go-to when it comes to your jumper knee person that comes in, has a pain site in the, in the patellar tendon area? What's kind of your initial investigation, and then how do you progress that exercise strategy or intervention?
Yeah, like I remember coming from a place when I had this kind of issue of stretch your quads. You got to stretch your quads. That's the problem. I wouldn't suggest that that's an all-inclusive answer. And so research kind of shows that restricted ankle dorsiflexion, so if your ankles are really tight, it puts more load through your tendon. So quick place to check is, do your ankles move evenly? Do you have control of your intrinsic foot? So like, yes, you can do like toe wiggling. You can see like, can you sit and look at your big toe lift up and down without moving the other toes? But then also its ability to spring. So, go barefoot on something soft and just hop up and down on one foot, hop up and down on the other foot. Yeah. Does it feel as springy on one side as it does on the other? If not, we might need to look at how you're storing elastic potential. So, quick fire drills, I'm sure any sort of like neurological drills, meaning like plyo, where you're not tired, you're just trying to get really, really fast, is a good place to begin to build up after a tendon injury.
Okay. So you'd look at kind of ankle as the first part, and then build up that compliance, either the elasticity. Do you do much tissue work in terms of quad or adductor, or like so again, as an athlete, I remember I was living at the time of cross frictioning being like a very popular treatment for tendons. As a professional now, I'm not a huge fan of it because I have experienced it, and
it is rarely the tendon that is mechanically the problem, right? So we want to understand multiple things. So we want to understand the biomechanics, which is what we're talking about from the ankle. How are you moving? Why is so much force going here? The next is how much loading are you doing? So, you know, was this excessive amount of jumping relative to what you've been doing in the past? And is that why it's hurt? The other layers that are often forgotten are hormones. So if you're a female athlete, different times in your cycle, you're going to have different rigidity in your tendons, and diet. So diet is also going to influence how these things are healing. We need to look at the whole picture instead of just beating the ever living crap out of the tendon. Yes. There's a time and a place for it, but you need to understand the role of treatment is kind of inputting a stimulus to improve healing. And if you're continuing to break down, like if someone's going in and you're getting everything beaten up all the time and it's not changing, might not be the best strategy. Yeah.
And I think that comes to a point too with, or the advantage of having multiple disciplinary coaches in your corner that you can kind of rely on to give you different information and stimulus and at different times, depending on what they need. And working with I'll say a team of people even, you know, is why you would want to do something like, you know, join a program, wink, wink, that has a nutrition and training and therapy incorporate in it, because it's not, you know, oh, I need to jump higher. Okay, well, that's a good result. And what if we start jumping higher and you start getting pain? Well, then we got to manage all the other lifestyle factors that are incorporated and not just the amount of training or the amount of jumping that you're doing. Like you said, it comes into all the different facets of your lifestyle that now start to impart itself on your ability to perform at a high level. With that same kind of question or that approach, we'll talk about the shoulder quickly, because I know as an overhead athlete, I mean, you've seen my shoulder mobility on my right arm versus my left is drastically different. So in a case of an overhead athlete, or obviously a volleyball player, you mentioned starting at the neck. What's, again, same question, different body part. What's the initial approach with that relative to the knee? So
few things. One, I would say, yes, asymmetries are important to consider, but they're not everything. So research will show in pitchers and in throwing athletes that you'll actually get a bony change in your humerus. So like your shoulder joint, that's going to change that range of motion from your hitting side to your non-hitting side. So totally getting caught up in it probably isn't the greatest place to start, which is generally why I start central and just make sure things are stable and then work through asymmetries kind of as they come up. When we're talking about a shoulder injury versus a patella injury, the difference is how you train it and how you rehab it. So your patella tendon is a weight-bearing structure. So stimulus that tells it to be able to load better is a productive stimulus on your knee. That tells the tendinocytes, so kind of the cells in your tendon that tell it how strong to be, that tells it we need to be strong. So when you offload a patella tendon, it becomes really problematic because you've stopped telling that tendon to get stronger. When we're talking about a shoulder, this is more of an integrative sequence problem. So it's not weight bearing. It needs to be dynamic and elastic, but the power needs to be generated from your core and your hips, not from your shoulder itself. So if you are having shoulder problems, you get a little bit from strengthening your rotator cuff. You get a lot of it from being able to integrate your shoulder blade in with your obliques. So that kind of comes back down to those rolling patterns and making sure you're initiating movement from your pelvis versus initiating movement from your rotator cuff.
Totally. I think, I mean, as we've kind of discussed in the past too, is just understanding that loading parameters. Because I know, you know, some athletes will say, oh, I need to develop stronger shoulders so that when I'm hitting, I can hit with more power. And it's like, well, you know, how's your single leg standing? How's your lunge pattern? How's, like you said, your rolling pattern? Like, how are all these other things that seemingly have very little to do with your shoulder that impart probably the most amount of change when it comes to the shoulder in the first place? So understanding it's not, and I think the point kind of came through with the patellar tendon and the ankle, is it's not necessarily the point that we're trying to fix. It's more so integrating the whole system to be able to work as a whole. So it's not the knee that's the pain point that we need to address. It's, how's your ankle? How's your hip? How's your, your neck in some cases? Like how are all these other functions happening? So I want to step kind of back a little bit, but, and because I meant to ask this actually at the beginning of this kind of interview question series, is why chiropractic? What's the advantage of working with a chiropractor versus working with a physiotherapist or a massage therapist or anyone else?
Yeah. And I would say that, everybody kind of takes their own course of continuing ed and has their own life experiences, and they bring it into their profession. Totally. So I chose chiropractic versus some of the other professions because I felt like it took a bit of a more global approach. And so in my own experiences, I had really positive results from people who took my whole system into account versus putting stuff that changed the pain on the pain point. And so that is how I ended up going into chiropractic school. And I was very fortunate to kind of cross paths with quite a few smart people and get into some smart rooms and absorb some knowledge. So, I mean, if we're talking about, how is my education different than others, I think it's just going out of my way to build relationships and having a lot of good resources to pull on with my own now experience and working off of other people's experience with working with athletes.
Awesome. Yeah, that's key. And I think that also addresses kind of some of the misconceptions too around, I have a sore shoulder. Should I go see a physiotherapist or should I go see a massage therapist? I think the reality is it's the quality of the person and the amount of information that they gather on their own in addition to their schooling that's going to be the biggest part. So having a good practitioner, not necessarily, DR or PT or whatever is behind their name, is, what's the quality of the person that's going to look at, like you said, the whole system as opposed to just, hey, can I make your knee pain go away so you can go play again? So I think that's important.
And when we're dealing with sports, try to find someone who understands your sport, right? Because, maybe you're a setter and someone's treating your shoulder and, maybe it has nothing to do with hitting at all. Maybe it has something to do with blocking, So ensure you have someone that you can kind of have your conversations with that are sport specific too.
Yeah. Yes, totally. Now, I guess we've got so much content already just in this short little conversation. And I honestly don't know where else to go except what would be for you. I mean, we can probably go on. I have probably a lot. Actually have a lot of questions that I've developed even in the course of this conversation, but for the sake of time, what are some key pieces of advice that you recommend to young athletes, whether they have an injury or not, to start to integrate into their lives some of the principles that you've developed with the Athletes Grid?
Yeah, I would say start to get a sense of your own body, as kind of broad as that may seem.
Yes.
At the end of the day, it's your body. You understand what hurts. You understand what's going on. If you can take advice, so like if you're taking advice from people like Rory, right? Like take those little gems, don't just listen to them in the moment, take them and absorb them and start to notice them in your day-to-day life. That's one of the biggest things, is kind of take autonomy over what's going on with your body. I'm sure if anyone's had an injury or you've had anything going on with your health, it's you search and search and search for answers, but then you come to realize you need to start collecting the information and start processing it yourself. Yeah. So take some autonomy, use help along the way. But things like diet and rest and recovery are really, really individualized. So listen to your body, make sure you're communicating with your coaches and your trainers. Maybe you are really tired one day. I know there's like a culture of like, get back out there, you're fine. But, listen to your body. Maybe you are not fine. So don't suppress those feelings. And make sure you start to take some autonomy and do a little bit of research on your own as you're getting information in from healthcare professionals and trainers.
Totally.
Yeah.
Well, that's great. And to tell everyone just how good you are at this, I want to say, when we started working together, I had maybe 3 or 4 chiropractor physiotherapists that I'd worked with in the past that similarly addressed kind of, oh, my low back is sore, so let's work on hamstring tension and glute function, and just kind of approaching it in that way and minimizing the pain approach. Whereas when I started working with you, it was, okay, well, like you said, we started rolling, and then we started doing some breathing work and some, not even really that much tissue work, which is what I had initially started out as. So one recommendation to everyone watching is, when you go in and you work with Kirsten, is understand that it's a process of unfolding. Like, you're not going to start with the end in mind, because the end is really an unknown variable when it comes to training. Just go in and be open to the information, and go in open to taking on kind of one step at a time to slowly, like you said, integrate new kind of gems and information with yourself. But like you said, understanding your own body first is paramount, because if you're just going in to have somebody give you the answers and then fix the pain, and you walk out, and then 2 days later you come back in with that same pain and they just fix it again, and you kind of go through this yearly cycle of finding a new therapist because, oh, they're not helping me with my pain anymore, or it's been so long and my pain has not gone away. That's when you need to start finding people like yourself, who can address kind of the bigger picture, and then start to narrow in on what the major things are. Is there anything else that you wanted to address or touch base on?
So if anyone has any questions, they can certainly reach out to me. Like I said, happy to help. Right now I'm doing free virtual consults. So if you have any questions, and you just, again, you have this chronic injury that never seems to be going away, super easy to just start to peel that down. Yeah. Perfect.
Well, thanks so much. And I look forward to talking again soon, and best of luck with all the Athletes Grid stuff. And now that you're going back in to live consultations, then good luck with that. And I'll talk to you soon.
Yeah, sounds good. Thank you for having me.
All right. Take care.